Due to COVID-19, the board's agreed to meet via Zoom only through the remainder of this season. I'm going to do roll call to identify board members that are with us today, starting with Pamela Cruz.
Oh, darn. I thought I was going to have a second there. Good morning. I'm here.
Morning, Pamela. Pete Cutler.
Here.
Morning, Pete.
Good morning.
Carrie Schaefer.
Good morning.
Morning, Carrie. Amy McGuire.
Good morning, I'm here.
Morning, Amy. Donna Hanson-Murray.
Good morning.
Morning, Donna. Dan Gossett. Are you with us today, Dan?
I see Dan, but he doesn't have audio. So we will check on Dan, but I see Dan is present. He has video, but not audio. So we'll check on that, but he appears to be here.
Hey, Dave, I've got on my screen, I'm only seeing 5 people. Is it a setting that I'm in, or is everyone else on as well?
I believe it might be how, Jessica, could you step in? I think it's how you're pinning things for purposes of the meeting, but there are 38 participants in the meeting at the moment.
Okay, bingo, there it was. That was the difference. Side-by-side speaker and side-by-side gallery. Okay, I'm good. I just want to make sure we didn't exclude everybody somehow, accidentally go into a room or something.
And it looks like Dan is having some trouble because he's bouncing in and out of the room. So we're definitely going to check on him, but he's trying to be here.
Okay. And Allison Polson, she's going to be late today. And Terry House will not be with us today. Okay. Also, Dana Giegler from the AGO's office is filling in for Katie Hatfield. Dana, are you with us today?
I am. Good morning.
Good morning. And I'm Lou McDermott. I'm the Deputy Director here at HCA and the SEB Board Chair. With both board members and presenters attending virtually, it'd be helpful for the board to hold their questions until each presentation is done or when the presenter pauses and asks for questions. Board members, we're also going to be watching in case you raise your Zoom hand to indicate that you have a question. The public is going to have an opportunity to provide general comments at the end of the meeting during the public comment period. Dave's going to give us an overview of today's agenda.
All right. Good morning, Chair McDermott, members of the board. We have a relatively short agenda again today. The one thing well, how about I walk through the agenda before? The main thing that is happening today is we're bringing you the rates for 2023 for the plans. After which we'll have a brief executive session to give you a little bit of additional context to those rates and the negotiations, but we wanted to do the public presentation and then move into executive session. One thing that is not on this agenda, which I just wanted to call attention to and will be on the next agenda, is we'll be bringing back SEB 2022-04, the UMP accumulator resolution that Jenny Switzer introduced at the June 23rd meeting. We'll be bringing that back on the 21st. Just working on the board briefing book, realized that as we were at the finish line that needed to have that on the agenda, but we'll schedule that for the 21st. So I believe I said at the last meeting it would be brought back to this meeting, but we'll bring that on the 21st for your action. I also want to highlight that the background we're using today is from my hometown, Tacoma, or I guess my current hometown, Tacoma, and part of Point Defiance Zoo and the Rhododendron Garden. The other piece that I wanted to highlight for the board is we have now identified how to have closed captioning and transcripts available in real time for board meetings. Some members of the public brought this to our attention at last week's PEB board meeting, and so we quickly identified what the challenges were for making that happen and have rectified that matter. For individuals who want to access that live closed captioning transcript service, it's sort of like your television. We've turned it on our end, but each individual has to turn it on their end as well. And the way that an individual does that is at the bottom of your screen. there is a button that has a CC closed captioning live transcript function. You click on that and then you activate, you click the button and that pops up that says show subtitle or view full transcript. And that's a way that an individual who would find that make the meeting more accessible for them. That's a feature that is now available and will be part of all of our public meetings for both the PEB and SEB boards and all of the agencies, other boards that are supported. So just wanted to draw attention to that. And with that, I turn it back to you, Chair McDermott.
All right, our first agenda item, we're going to vote for the approval of the July 15th, 2021 meeting minutes. Minutes are behind tab number 3. Are there any comments from the board? Do I have a motion to approve the minutes as written?
Pam Cruz, so moved.
Is there a second?
Donna Hanson, second.
All in favor say aye.
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 Any opposed? Thank you. The July 15th, 2021 minutes are approved as written. Next agenda item is the 2023 rates overview. Tanya Dool, the finance manager, and Kate Lavelle, fiscal information data analyst in the financial services division, are introducing the rates for 2023. And I'll be asking the board to take action at the July 21st board meeting. Their materials behind tab number 4. Tanya and Kate, welcome.
Thank you. Good morning, Chair McDermott, members of the board. My name is Tanya Dool, and I am the finance manager for the ERB program. And I am joined today by Kate LaBelle, who is on our finance team. I'm going to kick it off and walk through the first few slides and then pass it over to Kate. So next slide, please.
Tanya, real quick, I just want to check. I think we've got Dan and his audio working, so I just want to make sure to get that on the record that he is here. And Dan, I just want to check in. You're all good to go? Oh, maybe success. I'll email you, Dan. Go ahead, Tanya. Sorry.
No problem. Feel free if you need to interrupt again. It's okay. All right, so we're going to first start off with some slides that should look fairly familiar for most of the board members, but I thought this is a great reminder to walk through each year. So first, we're going to walk through a visual of how the employer medical contribution, or we call it for short the EMC, is derived. This is the employer's contribution towards medical, and it's established in the collective bargaining agreement for healthcare. The collective bargaining agreement for healthcare states that the employer medical contribution will be an amount equal to 85% of the monthly premium for the self-insured branded uniform medical plan, or UMP, with an estimated actuarial value of 88%, which is the UMP Achieve 2 plan. So to look at this visual, if you start at the top, you'll see a UMP Achieve 2 bid rate. A bid rate is the total rate that the carriers request. So this total bid rate of $588 is then multiplied by 85% to determine the employer medical contribution, the EMC of $500, with the employee paying the remainder at $88. So it's the bid rate, $588, minus the employer medical contribution of $500, leaving the employee to pay the remainder. So if we go to the next slide, we'll walk through this example on multiple plans. So the EMC is a flat amount regardless of which plan the employees enroll in. So across the top, you will see 3 plan bid rates. These are illustrative, just for example. So you'll see a plan A, plan B, and plan C. Plan A with a $700 bid rate, plan B with a $650 bid rate, and plan C with a $600 bid rate. We then subtract that EMC, which is 85% of the UMP Achieve 2 at $500 from each of the plans, regardless of the cost of the plan. So then the employee is, their contribution is set based on the remainder. So 700 minus 500 equals 200 for plan A, and so on throughout the remaining plans. On the next slide, we're going to look at this across all of the tiers. So the same plan A, plan B, and plan C employee contributions from the previous slide then are multiplied by each of the tiers. So tier 1 as a single subscriber is just the 1.0. Tier 2 for a subscriber and spouse or state registered domestic partner is ×2. Tier 3 is a subscriber and child or children. Regardless of how many children are on that account, it's ×1.75. And for Tier 4, it's a subscriber, spouse, or state registered domestic partner and child or children. Again, regardless the number of children on the account, it's ×3. Any questions on how we determine the employer contribution versus the employee contributions before I kick it over to Kate to walk through the main event?
Tanya, not a question, but just a reminder for everyone that the board set the tier ratio during the program launch within the confines of state law that mandated at most a 3-to-1 ratio between what we know today as tiers 1 through tiers 4. So just a reminder that that's how those tier ratios, that was the process and that the board had a role in setting those tier ratios.
Thanks for that reminder, Dave. All right, I'm going to kick it over to Kate to walk.
All right, thank you, Tanya, and good morning. My name is Kate LaBelle for the record. This slide in front of you shows the draft or proposed rates by plan for Kaiser Northwest and the Kaiser Washington plans. The far left column shown in white shows the plan names. In the next column, which is shown in light blue, is the draft or proposed employee contributions by plan. The middle column represents the employer medical contribution, or the EMC. Please remember the EMC is a function of the UMP achieved to, as illustrated by Tanya in the previous slides. And it does not change by plan selection. So you'll see the $600 in that middle column all the way down on all plans on this slide and the next. The final column in the dark blue is the total proposed bid rate by plan. Again, while we showed the employee contribution in the first column, the math is actually done in the reverse order. To determine the employee contribution, we take that total bid rate in the dark blue and subtract the EMC in that middle column to achieve what is the employee contribution for a single subscriber. And we only show this tier just because it would be a lot to show all of the tiers. So go ahead and show the next slide, please. This is just a continuation of the previous slide, but this content is for Primera and UMP. Again, you'll see the EMC remains $600 for all plans listed, and the proposed 2023 employee contributions are shown in the light blue column. Next, I'm going to walk through a comparison of the current 22 rates compared to the 23 proposed rates. I would like to orient you to this slide first because there is a lot going on and a lot of information. This slide shows a comparison of the 22 employee contributions to the proposed 23 employee contributions by plan. Again, in the far left column, we show the plan names in the white, followed by the 22 single employee contributions, and then followed by the 23 proposed single employee contribution. This slide also includes the change in single subscriber rate year over year as a percentage and dollar value, just for comparison purposes, as well as the enrollment data for each plan. I would also like to note, you'll see that we have included the Kaiser Washington Summit new plans that are being proposed for 23, which do not include data for 22, and that's why you see no information available in previous years, as well as the enrollment information. I would also like to note, if a plan's total bid rate fluctuates at a rate greater than the EMC, the total increase is borne by the member. And inversely, if a plan bid rate increases at a rate that is less than the change to the EMC, the member may see a decrease in their employee contributions. While the total SEB portfolio saw an average increase in total bid rate of 5%, most of the Kaiser plans, which are shown on this slide, are experiencing a decrease in employee contributions from 22 to 23. Again, this occurs in this instance because most of the Kaiser plans experienced an increase in bid rates, which was less than the change in the EMC. And because the employee contribution is driven by its relativity to the EMC, many plans here show a decrease in employee contributions over time. Next slide, please. This is a continuation again from the previous slide. There are so many plans we can't fit it on one. This is the same layout, but for Primera and UMP. You will see that the Primera and UMP employee contributions are increasing for 2023. And while the percentages may appear to be high, it is important to note that an increase in contributions on a smaller number will produce a higher percentage of change. While we see that the Primera plans are experiencing increases in employee contributions, their bid rate increases are in line with that which UMP is experiencing. As previously shared, because of the function of the EMC, if a plan's total bid rate fluctuates at a rate greater than the EMC, that total increase is borne by the member. So I'm going to pause here and see if there are any questions, because this is actually our last slide for employee contributions for medical.
I just want to add one piece of context for the board. It's something I believe said verbally last meeting, but can we go back to slide 8, Jamie? So Kate was highlighting that Summit 1, 2, and 3 have a non-applicable under the 2022 column because those plans don't exist today. But I did want to provide the context of what the access PPO rates are and remind everyone that it's a reduced service area. It does not include 5 specific counties. And those members will need to make another choice. There's information that was in the in the June 23rd board meeting about many of those individuals very well may select to move to a Kaiser core plan because they are seeing providers that are within the Kaiser core network, and others would likely choose between Primera or UMP. But for those who are still within the service area that is comparable between Access and Summit, today 2022's Plan 1 premium for a single subscriber is $104 versus Summit, which will be $77. Plan 2 in Access PPO today is $133 compared to what Summit will be here at $106. And Plan 3 under Access PPO is $185 compared to the $142. So all of those members are going to see who are in Access today, and ultimately, if they enroll in Summit, will have very similar benefit design and lower premiums. So just wanted to draw a little bit of attention there since Summit doesn't have a direct price point for 2022.
Thanks, Dave. All right, so we can zip forward. Thank you so much. The next slides I will provide more information regarding the other benefits that are offered. Next slide, please. This slide shows the subscriber-only dental rates for 22 and 23. I would like to remind everyone that dental is paid 100% by the employer, regardless of the tier selected by our members. Effective 2023, the Delta Care rate is increasing. This new rate includes a 3-year rate guarantee, which will expire December 31st, 2025. The Uniform Dental Plan, or UDP, which is our self-insured dental plan, is administered by Delta. The administrative fee is increasing effective 2023 and also includes a 3-year rate guarantee. However, this increase is offset by the experience component of this rate, which has an overall decrease, which is why we're seeing a decrease in that rate. Willamette, the final plan listed on this slide, has agreed to an additional year at their current rate, which will expire December 2023. Next slide, please. Here's a list of the other benefits that are offered. There are no changes in benefits or rates for vision, basic life and AD&D, and basic long-term disability benefits. Additionally, and not listed, there are no changes in the rates for the employee paid LTD or supplemental life benefits. And before I continue to read the proposed resolutions, does anyone have any questions? Great. As a reminder, the resolutions will be presented by carrier and not by individual plans. By approving these resolutions for a carrier, the board is approving the rates, any new plan offerings, and any underlying assumption and benefit design changes that are included within the rates presented. The first proposed resolution is SEB 2022-05, Kaiser Northwest Permanente, Kaiser Foundation Health Plan of the Northwest medical premiums. and reads, the SEB board endorses the Kaiser Foundation Health Plan of the Northwest Employee Premiums. Next slide. I won't read each individual one because the language is all the same. This resolution 2206 is for Kaiser Washington medical premiums. The next is the same, but for Kaiser Washington options, which includes those summit plans. The next one, 22-08, is for Premera medical premiums. And the last one is for the UMP medical premiums. And on the next slide is just the information regarding when we will return to you with these resolutions for action on July 21st, 2022.
And just to circle back to something I said earlier, we'll start off the July 21st board meeting with that UMP accumulator resolution, asking for action on that. It does not have a material impact on rates, but we will ask you to take that action on the self-insured design before voting on the premium resolution for UMP. Because you have more, there's more direct control of benefit design in the self-insured plan as a kind of a state managed and run plan, though administered by Regents and MOTA on our behalf. We ask you to take action on the individual aspects of the uniform medical plan, whereas on the fully insured plans, we have you, the assumption within the rates is that you are adopting the underlying benefit design changes that are presented during the June board meetings. So just wanted to circle back a little bit to that.
Great. So that's actually all of my presentation. So if you have any questions, this would be a great time to ask.
Any questions for Tanya or Kate? Seeing none, thank you very much. Appreciate it.
Thank you.
All right. Next up is our call for public comment. If there's anyone on Zoom that would like to provide comments, we're going to gather a list of speakers so we can manage the time allowed for public comment, which it appears we have quite a bit of time available. Would you please click on your virtual hand if you would like to speak? Dave, I'm not seeing any. Are you?
Not seeing any. Probably a good sign of the rates that we just introduced, that there's no public comment.
Going once, going twice, and so our next meeting will be July 21st, 2022, starting at 9 a.m. Any final comments, Dave, before we go into exec session?
I know that the board has had very long meetings for many years, and it's probably a little strange to have such short meetings, but I say short meetings means good news all around. So we'll have the last board meeting of the season is planned for the 21st. Yep. We'll bring back those resolutions for action, and we'll also have a couple of other end of year presentations. So the last board meeting will be a little bit longer than today's. We do have a little bit more information we want to share on a couple of topics. So do be prepared for a slightly longer meeting on the 21st.
Perfect. Anything else from the board before we go into session? All right. Pursuant to RCW 42.30.1101 subsection L or I, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchase healthcare services as provided in RCW 41.05.026. The exec session will conclude no later than 10:50 a.m. Board members, let's go ahead and take a 5-minute break while we transition to exec sessions. We're going to return to our public meeting after the session to adjourn the meeting, and there will be no further presentations. See you in 5, which will be, let's call it an even 9:30. Make it 6.